Okay. Good afternoon, everyone. My clock shows 12:02, so we're just going to begin our first ever virtual health fair with San Francisco Health Service System. Ryan, if you could go to the next slide, please. So welcome, everybody. Thank you for spending your lunch with us. My name is Jessica Shee. I'm the new Communications Director at the San Francisco Health Service System. I had the pleasure of starting in March right before shelter in place. And I remember during that time, I was, like everybody else, I was stocking up on supplies and I would do basically midnight shopping. I was like triangulating between Amazon, Walmart, and Target to find things like Charmin, because I had all this TP anxiety. I didn't want to use the paper cut stuff at home. And so I would do all this shopping. And behind the scenes at SFHSS, we were actually working to provide 24/7 EAP service, which would have been super helpful because I was doing midnight shopping. I mean, who's ever having issues only between 9 and 5? So that's what we've been doing behind the scenes to really expand our services for all of our members during this time. And you're going to hear from all of our health plans today about different ways that you can also access service. If you can go to the next slide, please. Oh, next slide. Thank you. So today is really all about you and your health, but it's also about our emotional health. And all of our plans will be highlighting their benefits and how you can access care, because we really want you to be well informed about your plans as you're making decisions for your benefit elections. So just so we set some ground rules, everyone participating in this presentation will be on mute. If you have any questions, you just click on that little question mark box if you just scroll around your screen. If you're joining us via your cell phone, it might be at the top of the screen. If you're joining us from your computer, it might be at the bottom. But if you scroll on the screen, a menu box will pop up and you just click on that little question mark box, and that's how you can talk to us and share with us any of the questions that you have. At the end of all of the presentations, we will have a Q&A session, and that's when we'll answer all of the questions. If we don't get to your question today, all of them will be found on our FAQ page. Next slide, please. So we're going to start off the agenda with Mitchell Griggs. He's our Chief Operating Officer, and he's going to talk about what's new with SFHSS. And then Carrie Bashirs is going to talk about the different well-being programs that we have. And Adam Gunther from Blue Shield of California will be talking about all the plans they have with us. Then Gabriela Urena will be talking about the Kaiser Permanente plan. And Iris Schaefer will be sharing the United Healthcare plans. And finally, we're going to also, so all of our health plans have also agreed to have office hours where you can ask them any questions that you have about the plans, and they'll be happy to answer your questions. And finally, we'll close off with the Q&A session. Next slide. And without any further ado, I'd like to introduce Mitchell Griggs, our Chief Operating Officer.
Good afternoon. I am Mitchell Griggs from the Health Service System, and today I want to talk about a few things. I just want to remind everyone from the very beginning, open enrollment has now started. It's October 1st, and open enrollment lasts through 5 p.m. on October 30th. So if you have questions about open enrollment, want to make your changes, that needs to happen by 5 p.m. on October 30th. I wanted to speak a little bit to member services and how we are doing this open enrollment and our member services customer support in general since March 16th, when the health order went into shelter in place. We have been providing telephonic member services, customer service support since then. And then this year, of course, we are still remaining closed to the public. Often, I'm sure many of you would come into our office and speak to someone face-to-face or go to one of our off-site events, whether it's at City Hall or One South Van Ness and several other places around the city, but we can't do that this year. We just don't have the resources to look at everyone and make sure everyone's sheltering in place, and we know that people don't want to come, they want to call, and so we need all of our available staff answering the phone. So this is our first virtual open enrollment event, a webinar, and I appreciate your patience, as this is the first time we're doing this, and all the little bumps in the road that we may have technically. Just remember, this is our first time. Member services during open enrollment, like I said, is all virtual and telephonic. So I want to remind people that member services is a very important place for you to find your answers to your questions. Our website, first of all, provides member service support. It is the great first stop to go to. We have done a lot of work on our website. I'll talk a little bit more about that later, and we constantly improve on that website. We often have surveys or discussions with members when they call in and get their feedback on the website. So we put a lot of work on it, especially here during open enrollment. But you can also call. Right now, we're only calling, like I said, telephonic customer service right now. But member services is your one-stop expertise for any of your eligibility or enrollment type of questions. Often we hear someone who is so distressed about accessing their benefits or navigating their benefits, and all they've spoken to is another coworker, or maybe their HR representative or their payroll representative. They haven't called us, and by the time they call us, a lot of time has passed and people are stressed, and it's just taken longer to get where they need to go. Navigating your benefits, often you may need to know, well, I want to change my medical provider, or how do I do that? And we can help you get to that spot in your health plan to do that. Or how do I find dentists in my area? And we can help you with that too. Accessing your benefits, a lot of people don't realize they have life insurance, or they need to change their beneficiary on their life insurance, or they don't know much about voluntary benefits. How do I get involved and find out more about that? So that's also something member services do. So I strongly suggest people call member services after looking at the website and for any of your questions. Just a reminder of our hours. This is during open enrollment throughout the entire year. We're open every day of the week except Thursdays from 9 a.m. to 12 p.m. and 1 p.m. to 5 p.m. Then on Thursdays, we're open 10 a.m. to 12 p.m. and 1 p.m. to 5 p.m. Next slide, please. As I mentioned, our new open enrollment website is put a lot of work into it. It looks gorgeous. Please go access it, look at it. You're going to find out things that you didn't know that you didn't know, and it's extremely helpful. This year, we provided you with an open enrollment packet in the mail. Most of you have got it by now. We certainly know that by the volume of calls we're getting right now. But if you haven't gotten it, you should receive it very soon. In that open enrollment packet that we mailed, we have these booklets, and you can see them down at the bottom, the blue, red, lighter blue, and green. If you're an active employee of the city and county of San Francisco, Unified School District, City College, or Superior Court, you got one of these colors here. And in that booklet is everything that you need to know for open enrollment. It includes rates, it includes benefit descriptions, it includes benefit comparisons, and all the things that we are required to state by the Affordable Care Act, so by law. So that's what you need to know for open enrollment. Now, a lot of people like to see the benefit guide. This is the full bit larger booklet that contains additional charter language about eligibility, or it contains more information on what happens to your benefits and leave of absence, etc. That book is available, or that guide is available online. Since we're not seeing people face to face, and we had to work with our printer to get things out in time. Our printer was very involved in the election this year and getting out election materials. So we opted to save us a little bit of time and to make sure you got your mailing on time by just opting for a digital benefit guide this year. We will be printing them in December, and they will be available hard copy at the first of the year. I want to encourage everyone, if you're a city and county employee, a superior court, or unified school district, you can use e-benefits to enroll. You don't have to use paper. You don't have to mail in that paper form or fax that paper form. You can go do that online. And you can do that through the portal, the employee portal. Most of you already use that, either to do your time or to check on your W-2s. It's in the same area, and you can go on our site or look at your open enrollment mailing to see how to get into e-benefits if you don't already know. However, some of us do need to use paper for whatever particular reason. Paper forms are available on the website, which you can download, complete. You can fax it to our office, mail it to our office, and we do have a drop box down at 1145 Market on the first floor by the security desk. So it's a locked box. You can put it in there. We pick them up every day at the end of the day and secure them. But if you have to use paper and want to drop it off, you can still do that at 1145 Market. Next slide, please. Want to emphasize here in the what's new is to always find out what's new and to keep up with what's happening at HSS. You should sign up for our e-news, and again, you can do that on our website. But going to our website, and at the bottom there's an area where you can sign up for e-news. We put a lot of work into this every month, and it's extremely informative, and everyone that signs up for it and elects to get this newsletter is very appreciative of it. Talk a little bit about what's new for plan year 2021. This particular virtual open enrollment event is just about the medical plans. We're splitting them up. We'll have some different seminars for FSAs and dental, and then for the voluntary benefits. So this one's just about the medical plan, and each plan will be discussing what's new specific for that plan. But just a few things to go over. Just, if you have flexible spending accounts, whether a healthcare flexible spending account or dependent care flexible spending account, you must re-enroll in those every year. If you're enrolled in 2021, it does not mean that you're going to be enrolled in one for 2020. You're not going to be enrolled for 2021. You've got to actively enroll in flexible spending accounts every year. These are IRS laws. It's not rules that HSS determines. We have to be in compliance with the IRS. Otherwise, we don't get to use them. Also, speaking of the FSAs, a few changes this year based on the CARES Act. And I know a lot of people have called and concerned that they may not be able to spend down their entire flexible spending account for 2020. You can get your over-the-counter things covered now under the flexible spending account. And I suggest you go to P&A's website. That's padmin.com, PADMIN.com. And they have an FSA store there where you can buy a lot of things that don't require a letter of medical necessity and have those covered by your flexible spending account. I also want to remind you that we do have enhanced voluntary benefits. We've been offering those, I think, about 3 or so years now. We do have a couple of new ones, actually 3 new ones. 2 of them are by MetLife. One is a critical illness, which is very good. Benefit offer is a great price. It's a much higher benefit than what we had before under the voluntary benefits. Definitely want to check that out, or go to the one in the webinars on the 21st, the 14th. We also have accident insurance by MetLife, which is also great. And last, we have an identity theft type of benefit through Allstate. And a good point about this benefit that differs from other identity theft benefits that you may be used to is it also does social media monitoring. I do want to remind people as well to definitely open up your open enrollment packets, look at those rates. Rates change every year, and it's important for you to know what your benefits are going to cost for the 2021 plan year. And that's about it for me. And I hope you enjoy our offsite virtual event. Thank you.
Thank you, Mitchell. And now I'd like to introduce Carrie Bashirs, our Wellbeing Manager, who's going to talk about our wellbeing programs.
Hi, good afternoon, everybody. So thank you, Jessica. I'm Carrie Bashirs, as Jessica mentioned, and I want to just spend some time talking a little bit about some of the wellbeing benefits that you have available to you. So we were really excited back in April to be able to expand our EAP services. So we now have 24/7 EAP for any one of our employees to call up, get someone on the phone, and get access to setting up an appointment with a clinician. So right now, most of the clinicians are doing everything through video or what they're calling telecounseling, or through the phone, or even there are some texting services available. So don't wait. We know there's a lot going on in today's day, as Jessica alluded earlier in some of the things that she was challenged with. But EAP is here to help us all out. So please take advantage of that service. Some of the other things that our EAP team does is really focused around what we call organizational services. Specifically, those include management consultations. So if you are a manager or supervisor and you'd like to talk with our EAP team about maybe some challenges that you're having with your employees on site or employees together, they can work with you on that. They also offer training and workshops. So they do a leadership in action training and a making work workshop as well. They also continue to respond to critical incidences. So although we are very much in a moment of crisis and have been for quite some time with the several things that have been hitting us over the last several months, there are more things that can happen in the workplace that would require some support from our EAP team. So they can act in response to a critical incident as well. Mediation is also something that I know as we kind of move to more of this virtual space, a lot of our workforce is telecommuting. And so working in a telecommute environment is very different from where we've been before. And so mediation services might be needed. And then there's de-escalation training as well. So again, reach out to our EAP if you have any questions about some of the services. In addition to that, we have been able to ramp up some of our online resources. So back in May, it was Mental Health Awareness Month. So in support of that, we created a dedicated webpage that's still active called We Are Here For You that has several resources that you can funnel through and look through that might be specific to something you're needing to engage in around your mental health or emotional well-being. We also created a COVID-19 well-being resource page. So again, a lot of great resources specifically that address, family and caregivers, to physical, to mental health and well-being. And then we're really excited about a new online, it's really more what I would call a resource hub called Credible Mind. You'll be hearing more about it as we get closer to launch, but it's really a tool online that allows you to type in any specific category that you're looking to learn more about. It can be financial, it can be, caregiving, it could be, stress, anxiety, and it'll pop up several different types of resources that you can learn more about that particular topic. It might include blogs or articles or books that you can read. So it really funnels them into a place that you can pick the best way that you choose to receive that information and download and take a look at it. Next slide. So since shelter in place, we've really had to shift a lot of the work that we've done. And so we've been able to bring it over into a virtual space, which is actually really quite nice and convenient in the fact that a lot of our services can be on demand as well. So we're offering our health education webinars, exercise classes, all virtual. We recently launched our diabetes prevention program and a healthy weight program as well, all virtual. Right now, both of those programs are closed. However, when we start the new year, hopefully you'll hear some more information coming out about some new sessions that you can engage in. And our link to our events page, which is sfhss.org/events, that's EVENTS, houses all of our information about how you can gain access to those types of activities. Naturally, we're also in flu season. So, it's very important these days that you get your flu shot or get vaccinated against the flu. So we are offering a number of worksite locations. If you're unable to access a worksite location, as many of us are also telecommuting and not going into the city, you can always go through your healthcare provider. So our website has a lot of different information that you can access and learn more about where you can get your flu vaccination. We've also ramped up some online resources specific to financial well-being. Smart Money Coaching is a program that is currently free to anyone who lives and works in the city. So please feel free to access that information. And then Set Up and Go is recently also been launched. It's a campaign that focuses on movement and ergonomics. So again, moving into a space where we do have people going into work versus people working from home. It really can help guide a department or an individual on how to focus on setting up your workstation correctly and then encouraging movement breaks throughout the day. Next slide. And then last, we're really excited to introduce a 4-week challenge that will come in November. It's the first challenge that we have going on this year. Naturally, we would have had a few more, but I think we're all in a different space today. So our challenge is going to be 4 weeks. It's launching November 9th. It's called Work of Art. And it really focuses on mindfulness, optimism, gratitude, and connection, which are all things that are very, very critical and even more important now. So you'll be seeing some more information coming out October 26th, which is the first day that you can register for this. And again, you can find that on our website at sfhss.org/WELL-BEING. Thank you. Next slide.
Great, thank you so much, Carrie. And now I'd like to introduce Adam Gunther, the Account Services Representative for Blue Shield of California. And I know many of you have questions for Blue Shield. Thank you.
Thanks, Jessica. In the next couple of slides, I'll be discussing the 2 Blue Shield plans offered by San Francisco Health Service System to its members, which with Blue Shield is the Trio HMO and the Access Plus HMO. Next slide, please. The Trio and Access Plus plans have the same medical and pharmacy benefits at the same member copay. However, there are some differences between the 2 plans. The 2 main differences are the monthly premium and the network. The Trio plan does have a lower monthly cost to you as a member and a slightly smaller network. Both plans allow members to self-refer to specialists within your medical group. Both offer urgent and emergent care while traveling both within and outside the U.S. Both offer teledoc to access virtual consultations for both medical and mental health, as well as our Wellvolution program to all SFHSS Blue Shield members. Next slide. There are some programs, though, they're only offered to Trio members, and those include an enhanced customer service with Shield Concierge. And just to give you a little bit, the Shield Concierge team includes experienced health advocates, health coaches, and social workers, all co-located with pharmacists, pharmacy technicians, and the team is it's a team of dedicated service representatives that are all committed to helping you with any issues that you might have. LifeSpring, a free meal delivery service, and Call the Car, a non-emergent transportation service, are also offered to Trio members. If you're a Trio member, you can check to see if you're eligible for these programs by calling the Shield Concierge number and asking to speak to a case manager. Also offered on the Trio plan is Heal, an on-demand service where a doctor will come to your home, your office, or a hotel room at a time that's convenient for you and also access to healthier foods at a reduced price through our Healthy Savings. Next slide. Now I'd like to talk to you a little bit about Teladoc. Teladoc is a great service offered by Blue Shield, and it's at no additional cost to you as the member. Next slide. Let's say you're at home, it's a Saturday afternoon, evening, and you're not feeling well. You obviously can't go see your doctor, and you do not want to go to the emergency room. With this benefit, you can request a Teladoc consultation using your computer or the app on your phone by going to the web address or just directly into the app. If neither are available, then you can utilize the 800 number. During the consultation, you'll be speaking to a board-certified doctor who will basically go over your symptoms with you, provide recommendations for treatment, and will even call in a prescription if one's needed. And again, this benefit is at no cost to you as a member and is available 24 hours a day, 7 days a week. Next slide, please. Something new to the San Francisco Health Service System members who elect Blue Shield is a tele-mental health through Teladoc, and that's new effective 2021. And if your consultation is for mental health, you'll be talking to a licensed psychiatrist who can prescribe certain medications, psychologist, therapist, or counselor who are available 7 days a week. However, the hours are from 7 a.m. to 9 p.m. That's different than Teladoc for the medical portion, which is 24 hours a day. The professionals that you will be speaking to can treat many mental health conditions, including anxiety, ADHD, depression, grief, and many more. And again, this benefit, just like the Teladoc medical, is at no additional cost to you as a member. Next slide. Finally, I'd like to talk to you about Wellvolution, which is available to all SFHSS Blue Shield members 18 years of age or older. Next slide. Wellvolution is Blue Shield's digital health care benefit available to, again, Blue Shield members all 18 or older. Wellvolution offers digital health coaching, exercise and nutrition advice, digital tools like weight scales and Fitbits to members with health risks. But Wellvolution also offers general well-being apps to help you remain healthy if you don't have a health risk or chronic condition. Next slide. To access Wellvolution, you would go to the Wellvolution website, which is www.wellvolution.com, and register. You'll go through a small, simple health risk assessment questionnaire for Wellvolution to better get acquainted with you and know what programs it should offer. And once you finish with that, you'll be provided with apps and programs that best fit your profile based on the answers that you provided to those questions. Next slide. For more information on the programs that I just talked about, or information on both the TRIO and Access Plus plan, we have a dedicated microsite page that we've created specific for HSS members, and that's at blueshield.ca/SFHSS. Next slide.
Great, thank you so much, Adam. And now I'd like to introduce Gabriela Llorena, the engagement specialist at Kaiser Permanente.
Thanks, Jessica. Give me 1 second. All right. Hello, everyone. As she mentioned, I'm Gabriela, the Kaiser Permanente representative, and there were really no plan changes from the Kaiser Permanente plan in 2020 to 2021. So I'm going to take this time to share some quick yet valuable information regarding your Kaiser Permanente care options and the wellness resources that are included with your Kaiser plan. Now, first, next slide, please. First, let me begin by explaining a little bit more about Kaiser Permanente's unique healthcare delivery system. Now, we combine both care and coverage so that our members can easily get the care they need to stay healthy. Within our facilities, we have everything from primary care, specialty care, lab, radiology, pharmacies, and more. And it's all under one roof, typically. Now, we also use electronic medical record systems to make sure that every time that you get care with us, each nurse, physician, pharmacist, and any Kaiser Permanente team member that you are speaking with are aware of your health situation and also can continue to personalize the care that you need. So anytime you also go to our other facilities in the states that we serve, we will also be able to access your health information to continue to offer that personalized care. Next slide, please. Now, how do you get care? Now, hopefully you guys are all familiar, those of you that are Kaiser members, but if you're not, there are many ways to get care thanks to technology. You can actually set up an appointment in person when needed, but you also have the options of doing over the phone or by video. And then you also have the capability of getting advice 24/7 over the phone or online, as well as emailing your own primary care physician to answer some non-urgent questions you might have and get a response within 2 business days or less. What's great about all of these telehealth options is that they are no cost to you, and it really allows you to save time and money when trying to get care in the comfort of your own home. You can also schedule and cancel routine appointments online, refill most prescriptions, check most lab results and appointment histories, as well as pay your bills through your kp.org account. And if any of you do not have the Kaiser Permanente app, I really recommend that you download it and start using it, because it really allows you to connect to your Kaiser team no matter where you are, as long as you have your smartphone. Next slide, please. Care when traveling. So with Kaiser Permanente, I think we touched about this slightly, but because you have telehealth options, anytime that you're traveling, you do have access to your own Kaiser team through your app, by email, by these phone and virtual appointments. But you also have emergency and urgent care coverage anywhere in the world. And typically, what ends up happening is that in most cases, it's at a reimbursement case. So if you're outside of a Kaiser region, outside the state, wherever you may be, you just get the care that you need for that moment. If you have a moment to call, you can double check with our advice nurse lines to just see what type of care you need, if it's an emergency room visit or an urgent care visit, just to save a little bit cost. But ultimately, it'll be at a reimbursement rate. So you would pay for the care that you need, and as soon as you're able to communicate with your Kaiser Permanente team what happened, they can begin the process for reimbursement. Now, 2 resources that we have on the screen is the 24/7 away from home travel line that you can call also for advice, or even about where to get care closest to you, or maybe how to prepare ahead of these trips. And kp.org/travel has similar capabilities as well, like even allowing you to be able to refill prescriptions enough and prior to your trip and enough for during the trip. Next slide. Now, we're here to be a resource for you ultimately and always, especially with your health. So at kp.org/coronavirus, we offer frequent updates regarding the virus, how to prevent it, what to do if you have any symptoms or concerns. And you can also find links there to begin an e-visit and get guidance with the nurse about testing, as well as looking to connect with your pharmacy locally to get prescriptions mail order. That's free of charge for shipping. So you can learn more about all of that information at kp.org/coronavirus. Next slide, please. Now, I think we're all aware of how challenging this year has been for everyone in many ways, and I just wanted to give a friendly reminder that through your Kaiser Permanente plan, you can also access mental health services. We provide clinical and supportive services for a wide range of conditions, including anxiety, stress, depression, substance use disorder, and autism spectrum disorders. Our team consists of psychiatrists, psychologists, as well as marriage and family therapists, addiction medicine physicians, and medical social workers. So as a member, just know that you don't need a referral, and there are many ways to access your first mental health appointment with Kaiser Permanente. And some of those ways can be, directly through your primary care physician, directly through the appointment line that's on the back of your member ID. And there's other ways that we also help offer these services to you when requested. But you can learn more about that and what's all included in mental health with Kaiser Permanente at kp.org/mental health. Next slide, please. Now, in addition to providing you care and health care specifically when you're not well, we also want to provide you with resources that you can use anytime to maintain or improve your health. Some wellness resources include ClassPass, self-care apps, wellness coaching by phone, online wellness tools, and health education classes, both online and some at our facilities. Now, members also have access to reduced specialty care rates like acupuncture and chiropractic care and massage therapy through the Choose Healthy program. And this program also provides wellness offerings like home gym equipment and wearable devices. Next slide, please. Now, one of the newest wellness offerings is both ClassPass and Calm. So through ClassPass, our members have access to over 4,000 on-demand fitness classes online, including cardio, strength training, and yoga at no cost. And you can also take advantage of reduced rates on live stream and in-person fitness classes like Pilates, dance, and boxing from top fitness studios. So to access ClassPass, you can do so through your Kaiser Permanente account when you visit kp.org/exercise. Once you've set up your account online through this website, then you can go ahead and move forward with your ClassPass registration, and your membership will begin immediately after you've registered and will renew monthly at no cost for all members. Now, for our Calm app, Calm is more specific to supporting your healthy mind, and we've offered this new to our members this year at the beginning of the pandemic, but the Calm app really uses meditation and mindfulness to help lower stress, reduce anxiety, and improve sleep quality. It's available to no cost to all adult members and offers something for everyone. Some of the features can include a daily Calm meditation every day, guided meditations for both beginners and advanced users, soothing bedtime tales for grown-ups and children, music for focus, relaxation, and sleep, and even some Calm master classes taught by world-renowned experts and celebrities. Next slide, please. Now, for all of you that may be starting new with Kaiser members, something that you can expect once January 1st hits and your membership is new, your plan is new, it's effective, is that within the first 10 days, you will receive a welcome member book and a welcome call to get you started, just to inquire that if you have any questions with your new health plan and how to get care, and maybe even transferring any medical information over. But the first 3 things that you really want to do once you become a Kaiser member is just to choose your new doctor, transfer any prescriptions. That's something that's more important, to help transfer prescriptions to continue your care. And then you can begin getting care as soon as you're a member. So you can do so online, like I mentioned, or even by calling the member services line on the back of your ID card. To learn more, visit kp.org/new-member. Next slide. Now, some new locations in Northern California that I want to quickly highlight is really just the Alameda Medical Office's expansions and the Care Essentials in downtown San Francisco. So the Care Essentials location is really important to you guys because it's going to open early in 2021, and it was really designated for the financial district, or the San Francisco Financial District area. We really wanted to offer a closer location for all of our commuters and all of our workers in that area to just get some quick primary care visits out of the way, or pick up prescriptions and get the care that they need, maybe while they're traveling after or in between work hours. What's great about this place is that it's just going to be really close and really accessible, and it's going to be in the new Salesforce Transit Center. Now, in addition to that, we also have a few mental health and wellness centers that have opened up in Oakland, San Francisco, and other areas as well, all throughout California. And we really built these locations nationwide to address the mental health care shortage that's offering really more options for our members of where to seek mental health care services, and something to call out of why they're not a part of our regular medical centers. And they're sometimes maybe down the street, but they're their separate building, because many members voiced that they wanted to have a more private and comfortable setting to receive mental health care services, and they didn't want to get nervous about running into somebody that they knew while they were taking their child to an appointment. So that's just something to call out, but really keep an eye on all of these new facilities opening up or that are already open near you. Next slide, please. And that is it for me today, everyone. So thank you for your time and attention. I've shared some tips about seeking care, as well as the many wellness resources that you have access to through your Kaiser Permanente membership. And I just hope that you found this valuable and take advantage so that you can try to stay healthy, mind, body, and soul. Thank you, everyone, and I'll be here for questions after the presentation. I will now pass it back to Jessica.
Thank you so much, Gabriella. And now I'd like to introduce Iris Schaefer, Field Account Manager for United Healthcare.
Thank you. Thank you for taking the time today to learn more about your benefits offered by United Healthcare and your employer. Next slide. Here are the two plans being offered by United Healthcare and your employer. An overview of the plans will be provided in the following slides. Next slide. With the United Healthcare Select Plus plan, you get national network and out-of-network coverage. You can receive care and services from anyone in or out of our network. Out-of-network means that the provider does not have a contract with us, and it will cost you more. Consider choosing a PCP who can be your partner in managing your care. Preventive care is covered at 100% in our network. When it comes to paying for in-network care, here are some basic examples of cost. The deductible for a single person is $250, and it's $750 for a family. After you reach the deductible, your co-insurance for a PCP or specialist visit is 15%. And the out-of-pocket limit for an individual is $3,750, and for a family, it's $7,500. This policy contains exclusions and limitations. For coverage details, see your official health plan documents. Next slide. With the Choice Plus plan, you can use any doctor, clinic, hospital, or healthcare facility, but you can save money by using the national network. You have coverage if you need to go out of network. Just remember, out-of-network providers will likely charge you more, and they can even bill you for amounts higher than what your plan will cover. You don't need to choose a primary care provider or get referrals to see a specialist, but we really suggest that you consider a PCP because they can be very helpful in managing your care. Preventive care is covered 100% in the network for this plan as well. And when it comes to paying for in-network care, the costs are the same as were previously discussed on the previous slide. Next slide. Use one of these three easy ways to find a PCP or determine if the one you currently use is in our network. First, you can look for the Find a Doctor button on myuhc.com. You can call the number on the back of your health plan card, or you can search using the United Healthcare mobile app. Next slide. Upon enrolling, activate your myuhc.com account to help you manage your benefits and your healthcare. Doing so will allow you to find network providers and provider locations, check account balances, manage your claims, track expenses, and pay your medical bills. It'll also allow you to estimate costs for care and learn more about preventive care services, find and compare medications, and refill, renew, and even transfer home delivery prescriptions. Next slide. Now let's take a look at your pharmacy coverage. Next slide. Optum Rx is your United Healthcare Plan's Pharmacy Care Services Manager. Optum Rx is committed to helping provide you with safer, easier, and lower cost ways to get the medication you need. The United Healthcare Prescription Drug List, also called a PDL, is a list of commonly prescribed medications covered by the plan. The PDL is organized into cost levels known as tiers, and choosing medications in the lower tiers can save you money. So the city plan prescription coverage is as follows. $10 for a $10 copay for a tier 1 medication, $25 for a Tier 2, and $50 for a Tier 3 medication. Next slide. Use network pharmacies and you'll generally pay less out of pocket. Our network includes thousands of pharmacies across the country. So before you go and pick up a prescription, check the medication costs online at myuhc.com. Whenever you arrive at the pharmacy, just present your health plan ID card and the pharmacy will verify your benefits and your eligibility and advise you of any out-of-pocket costs that you owe at the point of sale. Next slide. With myuhc.com and the United Healthcare app, you can enroll in home delivery, find pharmacies in the network, refill prescriptions and set helpful reminders, estimate the cost of medication, and do a general search in your plan's PDL. The United Healthcare app can also help you determine how a medication is covered and whether or not there are options to help you save money. Next slide. Now let's talk about some additional benefits that are included with these plans. Next slide. You can count on us to help make your healthcare experience easier. We'll give you support designed to help you save time and money and find care when you need it. Help is a call, email, or web chat away. Contact us for help with a personal touch. As a member, you can reach out to us by phone or by logging into myuhc.com and clicking on the call or chat button. We're available Monday through Friday during regular business hours. Next slide. Fertility Solutions program connects you with clinically guided support and education that can help you throughout infertility treatment. Next slide. Rally is a digital experience on myuhc.com that's designed to help you make healthy choices to your daily routine, set smart goals, and track your progress. You can get personalized recommendations to help you move more, eat better, and improve your health, and have fun while doing it. Earn credits for taking healthy actions, connect with a community of people, and get the support you need to stay motivated. Next slide. Whether you want to lose a lot of weight or just a few extra pounds, Real Appeal is designed to help you with simple steps and support along the way for lasting weight loss. This program includes a personalized transformation coach, 24/7 online support, and a success kit featuring a personal blender, a digital food scale, and several more items. Next slide. Get access to care online at any time. When you need care, anytime, day or night, virtual visits can be a convenient option. From treating flu and fevers to caring for migraines and allergies, you can talk to a doctor by video or phone 24/7. Please note there is a cost for virtual visits. See your health plan documents for details. Next slide. To learn more, visit us online or give us a call and we'll walk you through everything. Thanks for your time today. And now I'll turn it back over to Jessica.
Thank you so much, Iris. And all of our health plans have agreed to offer office hours during the month of October. You can access the office hours at their microsite for SFHSS. You just have to go to our homepage first, which is sfhss.org/OE 2021. And then when you click on the health plans and go into their page, you can select to use one of their office hours. All you have to do is click on those buttons that you see on the slide there. Next slide, please. Great, now we will open it up for Q&A. I've also listed our address as well as our member services telephone number and our operating hours. And so I'm just going to go down on the first question that we have is about UHC. Do you have examples? Iris, if you could help do you have examples, a breakdown of cost for a UHC city plan, like in the event of hospitalization or chronic condition like diabetes or a life event like giving birth?
If I know that we have like a summary of benefits and those are posted each year. So I believe that those will be shared as like typical examples. If the question is more about, well, what is the cost to, just the initial cost, there's a deductible, of $250, for an individual. And then after that, it's a 15% co-insurance. I hope that's at least a little bit helpful.
Yes, this is Mitchell. This is Mitchell from the Chief Operating Officer here at HSS. Just to confirm, yes, the summary benefits for City Plan are on our website, and it does have a sample, a breakdown of a situation and cost.
Great, thank you, Mitchell. And the next question I have is about escalation, actually. And if Mitchell, if you can tell us about the process for escalation. Some of it is regarding negative experiences with individual providers or IPA, practice, hospital, or with HSS.
So each health plan that we contract with does have a grievance procedure. And so if there are issues with the provider or an experience with the provider that is under, one of the health plans, each plan has a grievance procedure that is published in our EOCs and potentially some of our summary benefits. If there is something that, feedback that they, members would like to give HSS, they can do that in writing. Or if they have a grievance with HSS and one of its eligibility or enrollment determinations, they can do that in writing and submit it to 1145 Market Street, the address on our website.
Great, and that address is posted on the slide right now. The next question, back to you again, Mitchell. So how long does the CARES Act remain enacted? Will the new FSA eligible items be applicable in 2021?
So there are parts of the CARES Act that do expire at the end of the year. However, at this time, it appears that the new eligible items do extend into 2021. So when I was talking about over-the-counter products, that will continue in 2021.
And my next question is for all three of our health plans. A member wants to know about mental health benefits, how to access care. Do you need provider referral? Like, what would the standard cost be for 10 visits? Gabriella?
Yes, this is Gabby with Kaiser. Can you guys all hear me?
Yes.
Yeah, with our mental health services, I mentioned them a little bit in this slide, but if you were to go in for an individual treatment with a therapist or psychologist, it's going to be a $20 copay per visit. And there's really a lot of ways that you can begin seeking care, but again, you don't need a referral. So even if you called the appointment line directly and just let them know you're interested in setting up your mental health appointment, they will connect you and help you get started on your first appointment. You can do so at kp.org/mental health online, as well as with your primary care physician in person or by email. They can help connect you to what you need to start getting that first appointment.
Hi, it's Iris from United Healthcare. For mental health services, you would go to liveandworkwell.com to find in-network providers. Coverage is, the typical deductible. Once you meet the deductible, it is 15% co-insurance for an in-network provider. If you decide to use an out-of-network provider, that you can choose to do that. There is, a deductible, and then coverage is 50% of the allowed amount for an out-of-network provider. Okay, and that whenever you start going to out-of-network care, that cost does fluctuate and it does vary widely. Costs are it's a lot more controlled whenever it's in network, and it's a lot more consistent by provider and provider type. So that's something to consider whenever you're trying to figure out, whether or not you want to use in-network or out-of-network services.
Great, thank you, Iris. Our next question is for Mitchell again. Can SFHSS share a comparison chart of the rate increases for all of our plans, 2017, 2018, and 2019 years?
So there are comparisons over the years. They are on our website. They are presented to our board, so it's part of our board documents. So I mean, they are accessible there. We don't have a particular one document that look across over those years. But a good resource would be to go onto our website, look onto the board section of the website, and you can search for various things like 2019 rates or something like that. And there are documents that our actuaries present to the board to get them approved. That's about the best resource we have at this time.
Great, thank you, Mitchell. The next question is for Carrie Beshears. Will the EAP, the 24/7 EAP program, continue after the COVID crisis?
So right now, that is currently unknown. We do know that the program will extend through another year, we're hoping through this current fiscal year. And so we'll know more as we continue to go along in the process. We would love for it to continue, but we need people to use it. I mean, it's a great and amazing service. So, definitely we encourage you to have your coworkers or you engage in the service should you feel like you need it. So as of right now, it's completely unknown as to what that'll look like after COVID.
Great, thank you, Carrie. And this one's for Adam. Is the mental health carve out for TRIO and Access both with Magellan? They do not pay well and it's hard to find providers.
The simple answer to that is yes, it is with Magellan.
Okay, thank you, Adam. The next question is, so a lot of individuals may benefit from the complementary and alternative therapies such as chiropractic care, acupuncture care. However, not all providers are the same. Most of the best providers in the city are not covered at all under Live Healthy with Kaiser or Blue Shield, and these services can be costly. Are all chiropractic and acupuncture practices reimbursable at the plan rate under City Plan? Oh, so this is for UHC.
Sorry, can you repeat that? This is Christina. I'm a little confused as to what the question was.
So this member would like to know, under the UHC City Plan, can somebody go to any chiropractor or acupuncturist and be covered under your plan? And
yeah, I'd have to double check that acupuncture is covered, but chiropractic is for sure. And yes, you can use out-of-network providers. However, the same thing that Iris was discussing earlier applies. If you use an out-of-network provider, they may bill above the amount that United Healthcare will deem is acceptable. For instance, that provider may bill $100. UHC may say the claim is only reimbursable at $50, and then the member would receive 50% of that $50 back. So the actual amount that the member might receive would be $25, leaving the member still with $75 of responsibility. So that's something to keep in mind if you utilize an out-of-network provider. That was just an example. That's not in any way, shape, or form how much we would reimburse.
okay, thank you, Christina. And this one is for Adam. If I only see UCSF doctors, will I lose any benefit by choosing TRIO instead of Access Plus?
We're at the end of the hour. I think we lost Adam because he had a 1 o'clock hard stop.
Okay. I think there's still quite a few questions left, so we will get to all of your questions and answer them on our website at sfhss.org/OE2021/FAQ. So we're sorry if we weren't able to get to all of your questions at this time, but we will be sure to post them there hopefully by tomorrow. Thank you so much, everyone, for your time.
Thank you.
And we hope this session was helpful. Please feel free to send feedback. We have a few more webinars this coming month, and so we'd love to know how we can improve. Thank you.